So we know within the South Asian communities, Bangladesh, Pakistan, India, Nepal, we know that, and the surrounding countries within the South Asian countries, that we need to take it seriously because it's so prevalent. And the reason that we need to take it seriously, not just because so many of us have it or will get it, is because it is a worrying condition. There are lots of risks involved. For example, you can go blind, you can lose your limbs, kidney damage, end organ damage, lots of different risks with diabetes. Now, the most important thing is there is something we can do about it. So where there is something we can do is even more of a reason of why we need to be more aware, we need to talk about it, we need to educate ourselves, because more of us have it, but there is something we can do about it, which means let's do it, let's get it under control. We can work together as a community. You know, we are higher risk, so let's just do it together. You know, we're all talking about it, maybe talk about it in a positive way, give each other good advice, you know, let's do it together. I think the single biggest barrier for our South Asian communities, you know, the barrier to manage your diabetes or accept your diagnosis is language. Language is a huge one, and then understanding around your diabetes. So I think they go hand in hand. People have lots of misconceptions, worries, there's a lot of negative thinking. There's lots of people thinking that, oh, if I've got diabetes, I need to change my food completely, or if I've got diabetes, I can't have children. So I think the biggest thing is language, and understanding is one of our biggest barriers. And unfortunately, because many of the elder generations, their English isn't necessarily their first language, or they may be able to speak English, but just not that comfortably. Maybe they aren't able to access the information, or they're not aware that they can ask those questions. So I think that's our biggest barrier, is that it needs to be spoken about correctly, and people need to give themselves and take that responsibility of their health, because your health is your responsibility. So come in and speak to us. Let's do this together, but it's your responsibility, just like it's ours to do things in your best interest to keep you healthy. It's your responsibility to keep yourself happy, healthy, and live a long and healthy life. Lots of people don't know where to start when they've been diagnosed with diabetes. Now, you don't need to worry about that, because you'll be working with your healthcare professional to figure out how do we need to manage your diabetes. Some people we can manage with diet to start with, and then we'll regularly be checking your sugars. You will be continuously checked by the nurses every year. You have the eye screening program, bloods at least every year. So those will be closely monitored. What that means is we can come up with a plan of how we manage the diabetes. So it may be that you have a conversation with your GP or with your healthcare professional about the various options, depending on what your sugar level is. So if it's on the slightly lower side, it means that the diet control side may be appropriate. But if it's on the higher side, it may mean that the tablet oral therapy may be appropriate. Remember that if you control your diabetes, it doesn't necessarily mean that you will stay on tablets forever. It may mean that you may progress though, and you may need more tablets to control things, but equally it may mean that if you do the exercise correctly and control your diet, that you can keep it under control or push it backwards actually. So there are different ways of managing, and there are lots of therapies out there. Commonly people are on 3 or 4 oral tablets, many of whom are on insulin as well. And you don't need to decide that. We decide what's best for you, for your lifestyle, and we do that together. So don't feel worried or overwhelmed that, you know, what am I going to have? We talk through all the different types of tablets. Lots of different tablets are associated with, you know, maybe some side effects that may not suit you. You know, we'd need to check your liver function, your kidney function, to check whether certain medications are appropriate. So we have those discussions continuously with our patients to figure out what the best treatment program is for you.